Hello, good afternoon. So I am Dr. Amita Shah, Senior Consultant and Head at Columbia Asia Hospital. So today we are on Facebook Live and I am all set to answer your questions related to pregnancy. So one of the questions is I'm pregnant and when I'm annoyed, I start to nosebleed. What's the reason? What happens in pregnancy is that there is increased vascularity in all your body systems. The vascularity in the gums increases, the vascularity in the nasal cavity increases, and that leads to nosebleed, and sometimes it can also lead to bleeding from the gums. So don't worry that it is anger that is leading to the nosebleed. Another question that has come up is I'm 31 weeks pregnant and my blood pressure is rising. Is that normal? Well, your blood pressure during pregnancy is a very common condition. These days it is rising because of stress-induced pregnancy. Because there is a lot of stress, the lifestyle changes, so a pregnancy induces blood pressure. This is called pregnancy-induced hypertension. Normally, it would happen in patients who are elderly, who have a family history of blood pressure, and if they have some condition which is related to their kidneys. That leads to pregnancy-induced hypertension, which can be mild, moderate, or severe. Nothing to worry about, but yes, if there is pregnancy-induced hypertension, then you have to take care. You have to visit your gynecologist more frequently, and if she desires and if it is needed, then you will have to be put on antihypertensives and your blood pressure monitoring has to be done regularly. Increase in blood pressure, if it is not monitored and not controlled by medications, can sometimes lead to complications like there may be growth retardation, your baby may not grow well, there can be preterm delivery, there can be intrauterine growth retardation, and sometimes it may also lead to fits during pregnancy, which is called eclampsia. But these are rare conditions. The eclampsia is a rare condition which will happen only if your blood pressure goes uncontrolled. So a pregnancy-induced hypertension is a high-risk factor during pregnancy, which needs to be well controlled. Another question which is there is that, does thyroid affect my baby? This is asked by Neha. Well, Neha, thyroid in pregnancy is a very, very common disorder, and it could be hypothyroidism or hyperthyroidism. So basically, thyroid is a gland in the neck which releases certain hormones called T3 and T4. Now, supposing the thyroid hormones are being released less, then your TSH levels, that is the thyroid stimulating hormone levels, go high. When the baby is inside the uterus, when it is a fetus, the baby doesn't have a thyroid gland of its own. So till 14 weeks of pregnancy, the baby depends on the thyroid hormones of the mother. Right? So if you do not have enough of T3 and T4 in your body, the baby doesn't get enough of T3 and T4. Now, T3 and T4 hormones are needed for the brain development and for the spine development, basically the development of the neurons in the baby. So if T3 and T4 are not adequate, there won't be adequate neurons development and brain development in the baby, which in turn can lead to low IQ levels in the baby and some kind of mental disorders. So it is very, very important that your TSH levels are well controlled, which effectively means that your T3, T4 levels are well within range to give a good supply to the baby. So if your TSH levels are high, means you have hypothyroidism, we put you on thyroid hormones, commonly, as you may know, could be L-troxin or Thyronorm. There's another question that is there, I can see. I'm having pain in my lower abdomen. I'm 18 weeks. Afraid something is happening to the baby. Okay, so when there is pain in the abdomen at 18 weeks, there could be multiple problems, right? So the first important thing is that you have to be sure that you're not ignoring the pain. You visit the gynecologist, because pain in abdomen could signify that either you are having some kind of indigestion, the pain could be because of some kind of urine infection, it could be because of constipation, it could be because of loose motions, or it could sometimes also signify something sinister, like you could be going into a preterm labor, or you could be going into a threatened abortion kind of a thing. So unless and until a gynecologist examines you, you really can't be sure as to what's happening. So it is important to go and visit a gynecologist who may prescribe certain tests to you, like a urine test will tell us if you have a urine infection. A stool examination may be required, may not be required. Most of the times we don't require. Clinically examining you by doing a per-abdominal examination will tell us if the uterus is relaxed or not. If it is relaxed, then we know for sure that you're not getting uterine contractions and you're not going into preterm labor or going into a threatened abortion kind of thing. An internal examination sometimes also may be needed to find out if the mouth of the uterus is opening up or not. If it is not, then definitely you are not going into preterm labor. Appropriate medicines as per the diagnosis will help us in controlling your pain. I am breastfeeding mother. Please give your suggestions to lose weight. Okay. So well, if you are breastfeeding, then it is very important that you eat the right stuff. Right stuff means that you take a healthy, nutritious diet, because what you're eating is eventually getting transmitted onto your baby. A healthy diet doesn't mean that you're taking a lot of fats or carbohydrates. A healthy diet means that you are taking enough of proteins, enough of carbohydrates, enough of fats, vitamins and minerals. So what you need to do is that in addition to taking a healthy diet, you have to exercise. That is the main goal, how you can maintain your weight, because effectively weight gain and weight loss depends upon the right balance between the calories that you're taking and the calories you're spending. So if you're taking the right amount of calories which are adequate for during lactation and you're spending those calories by doing the exercises, then I'm sure that you will not gain weight and you will be in a fitter shape, giving adequate nutrition to the baby that is needed during lactation and adequate nutrition to yourself also. All reports are normal in my 18th month. In my 18th, it should be weeks. In my 18th week pregnancy, but don't feel anything. Is it okay? Level 2 scan is after 2 weeks. Okay, Jigyasa. So 18 weeks is not the time when you will start feeling anything. Actually, if you are first time pregnant, I believe this is your first pregnancy, so you will start feeling fetal movements only at around 22 to 24 weeks of pregnancy. So level 2 scan will tell us whether everything is fine or not, because level 2 scan is effectively a detailed anomaly scan wherein the ultrasonologist will be looking at all the physical abnormalities that may appear in the baby. But definitely you will start feeling the fetal movements at around 22 to 24 weeks of pregnancy, right? So don't worry, at 18 weeks you will not feel any fetal movements, and it may happen that even at 22 weeks, 24 weeks, the fetal movements that you perceive may be just in the form of a small butterfly sensation or a flicker kind of a thing, right? The actual kicks which you are waiting for will definitely start happening at around 26 to 28 weeks of pregnancy. I hope this satisfies your question. So we have another question here. I go to the loo a lot of times for urinating. Seems like a hormonal thing, but I'm not sure. I have constipation also. So this is Abhilasha. So Abhilasha, frequent urination and constipation during pregnancy, are two common symptoms to happen in pregnancy. So you haven't mentioned as to which week of pregnancy you are, but definitely frequency of urination is a common symptom to happen in the first week of pregnancy because of your hormones which rise. But if you are supposing in the last trimester of your pregnancy around the 8th or 9th month, then also you will feel frequency of urination, because basically the baby is pressing onto the large uterus, your womb is pressing onto the urinary bladder, which causes you to have a sensation of going to the loo frequently. Constipation also is common to happen, and to avoid constipation, I think what is very important is that you need to take a lot of fluids. At least 3 to 4 liters of fluids you must take, along with a good high fiber diet. Increased intake of fluids as well will relieve you of any urinary infections which are very common to happen during pregnancy, which again can be one of the reason for frequent urination that you said that you were having. So always get a urine test done, a urine routine and a culture, which we do recommend every 3 months or maybe more frequently, to rule out any urine infection, because UTIs or urinary tract infection during pregnancy can lead to preterm labor and can lead to premature deliveries. Hi ma'am, I am 35 weeks pregnant. The doctor advised me full bed rest as she doubts it would turn into a preterm labor. I am quite tensed about it as I find difficulty in sleeping on my left side, as well as there is a lot of itching on my stomach and abdominal area. Well, if you are 35 weeks pregnant and if the doctor has advised you bed rest, then that means there is definitely some reason as to why it has been done. If on clinical examination, that is on a per vaginum examination, the doctor has found out that your cervix is short or the mouth of the uterus has started opening up, in that scenario sometimes we do advise bed rest, because we don't want you to deliver before 37 weeks. Now 37 weeks is term pregnancy, after which if you deliver, then it is an appropriate time. So between 35 to 37 weeks, if we perceive that there are chances that you may deliver early, then we do advise you bed rest. Sleeping on the left side is not necessarily a definitive thing to do. What I would suggest is that whatever position is comfortable to you, you sleep on that side. It may be lying flat on your back, or maybe on the left side or on the right side. A left lateral position is definitely recommended if your doctor has advised you because of your high blood pressure or your baby is not growing well inside the uterus, because a left lateral position helps. There is increased blood flow in the left lateral position to your baby, which helps in the growth of the baby as well as it helps to relieve the blood pressure. If these two factors are not there, then you can lie down in whichever position you are comfortable in. Okay, so you mentioned that you were having itching on your abdomen. Now, itching on the abdomen could be because of increased stretching of your abdominal skin because of the increasing size, which is very common to happen. For what I would recommend that you put some oils, or you could use creams for stretch marks, which help to relieve itching. But you should also get your liver function test done, because sometimes the liver enzymes could get spilled into the skin, which is known as cholestasis of pregnancy, which itself can lead to itching during pregnancy. If your liver enzymes are high, then we do have to put you on medications which will help to control the liver enzymes and bring down the itching. Which says, is it normal for milk to come out from the breast after miscarriage? Yes, it is quite normal. May happen in some patients, may not happen in others. But definitely once you get pregnant, what happens is that there are some physiological changes that start happening. Okay, so because of this physiological changes, one of the changes is that the prolactin hormones rises in the body. That prolactin hormone acts onto your breast and starts causing milk production. Now, after the miscarriage, what happens is the prolactin suppression happens and there is sudden depression, or the prolactin levels go down, which can suddenly lead to milk secretion from the breast. Hello Suman, you've asked, my 9th month is running, but my baby growth is less than normal, about 2 kgs at 36 weeks, and liquor is also low from below normal value, and presentation is also breech. What should I do at this time? So Suman, if this is a breech presentation and the liquor is also low, and you said that the weight of the baby is around 2 kg, then I'm sure then we need to deliver you a little early. So 37-38 weeks is the right time when we need to deliver you. Breech presentation, as I said, we can't take a chance and deliver you normally. We will have to plan an elective cesarean section for you. 38 weeks is the right time to plan a cesarean section, because by 38 weeks you are almost term pregnancy. Your baby is well matured, and since the baby is not growing inside, that means there is not enough nutrition that is growing. So in that scenario, we need to terminate your pregnancy and deliver you at 38 weeks. I think that would be good for the baby as well as good for you. There's another question from Srija. Reason of premature baby. Well, Srija, you need to understand now what is premature baby. So mature baby is 37 weeks. and any delivery which is happening before 37 weeks is a premature baby. There could be multiple reasons for premature delivery. There could be medical conditions. You could be having a pregnancy-induced hypertension. You could be having a pregnancy-induced diabetes. There could be infections, vaginal infections, urinary tract infections. All these could lead to premature deliveries, right? If you have a twin pregnancy or multiple gestations, like maybe triplets or quadruplets, that also can lead to premature baby. Any kind of extreme stress is also known to cause premature babies.